I'm Chris Stout, endovascular and vascular surgeon with Ozark Regional Vein and Artery Center. Today, we're going to talk about evolving endovascular embolization techniques. One of the really new, neat things that we can do is these people that cannot have a knee replacement or they don't meet the criteria quite yet, but they're having a significant amount of pain that's not able to be treated with injections or medications, and it really limits their function, is we can get in there and select out the arteries that feed the little parts of the knee and go to the knee joint. And as you get more bone on bone and arthritis in your knee and other joints, what happens is that you develop this tissue that grows in there, trying to fix it, trying to heal it. Your body is very dynamic in trying to heal. If we can get into those little arteries and just kill off just a little bit of the tissue or get rid of the little bit of tissue that's causing all that pain with those nerves and knock out the sensation of those nerves and those blood vessels, then we can decrease knee pain. And that's one of the neat things that I can do using these little tiny particles, fancy word of embospheres. And they're just, they're in the microns of size, hundreds of microns in size. So that's very, very tiny. So I can put a catheter down in through the artery down to the knee and then inject these micron sized spheres that then travel down to those little tiny microscopic blood vessels, and it clogs them off. Another neat procedure is, prostate artery embolization. Kind of the same idea. And it's another evolving technique, and people have, prostate enlargement, rather than having to undergo some type of, transurethral or sticking something, through the pelvic region and to the prostate to fix it, or even surgery to fix it. We can get a catheter down there and get it really close to that prostate and use these same type of technology to send these little tiny spheres down there to not kill the good tissue, but it will decrease the size of the prostate by causing it to be starved with just enough blood supply that it starts to shrink. Another neat thing to do is uterine fibroid embolization. This is a little bit more complex because you have to be careful in how you do this. And the reason that we do uterine fibroid embolization is we want to preserve the uterus. So if somebody wants to have children in the future, the classic way to treat a uterine fibroid is go in there with surgery, and the gynecologist has got either laparoscopically through a scope, sticking it in you, or open surgery. They have to remove the uterus or a part of the uterus. And a lot of times you wouldn't be able to have children after that. Well, one of the procedures that we can do, even if you aren't going to have children again, is to get a catheter snake clear down around and in there. And again, it's complex because we want to keep the ovary going good, but we want to select the artery and find the different anatomic variant to make sure that we go towards that fibroid. And again, we use that same technology, those little tiny spheres that go in there. And a lot of times these can avoid a big open surgery on these patients.